Well, it's not good morning or it's not good night. It's actually just about midnight. I could not sleep, so I got up and thought I'd come work on this video that I'd been preparing. And so we'll just go through that. This is adult orthodontics we're doing on this lady. And she is a real good patient. And let me get started on it here. Didn't turn the air conditioner off, so it may make a little racket and we may have some interference here. But there are a good many adults who are tongue thrusters, and they've been tongue thrusting all their life and they don't seem to know the difference, but it makes a lot of difference. Let's go and I'll show you some of this as we go along. I've started out on the back side of it. This is after we finished the case in '84, when in 1984, and we have finished it up, and we started it in 1982. I'm going to show you the models in just a minute here, and I'm proud of it. And that I'm going to come back and show you this about 16 years later, and just remember how it looks here. And it's in perfect class 1 relationship, but it started off with a class 2 on one side and a class 1 on the other side. Now you can see this person is wearing the retainer. You see that little groove in there, maybe too much, but everything is lined up real good. Now on the bottom we had a little bit of class 3. It was kind of a super class 1, and we took out one lower central right here. We'll show you that in just a minute, and it matches up real good, and that's one way you can do some of these edge to edge mild class 3 cases. You just take one lower central out and line the other teeth up. It works great. Okay, here is the appliance that we put on her. We've shown you in tongue thrust appliance. Now we have a lot of bands left over, and some other orthodontic friends of mine, when they went to brackets, gave me their bands, their old bands, and so I have a slew of lower anterior bands, and that was real good. So we put those on, and we'll come back and well, let me go back and show you. We're going to spot weld a 030 wire right onto this, and then flow solder all over that, and then we'll bend these back, and we're going to have a little fingers going back, kind of like just like 4 fingers going back, and when you cut them off they're kind of sharp, and so sometimes we just leave them sharp. Some people want them that way. This is from the front. We band these teeth up, so we had to separate them a little to get bands on them. And here the 030 wire has been soldered and bonded on. I think I'll show you here. Now this picture is the 030 wire spot welded on here. We do the spot weld, and then we're going to come back and flow solder over each one of these. And then after you do that, you bend this wire back. I will show you that in just a minute. If I go back here, you see that's got solder on it, but you'll see it better in another video in just a minute. Now after we solder it, we bend these wires back, but you have to make certain that this does not touch the pallet up here. And then you've got to take into consideration, a lot of times there are open bites when you're doing it. When you put this on there, they go up and bump these things about once or twice, and they stop. And when the tongue stops coming through there, the teeth erupt back down into place. And we'll show her teeth here in just a minute. This is the little fingers that are spot welded and soldered onto the back of these, on the back side of the lower anterior teeth. And that is, I found out, is the best thing in the world for for tongue thrusters. I've tried this on a medical doctor, and he had a bad tongue thrust, and he told me, said his tongue went up there about twice and hit these things, and then it just will not go up there. It's I've not ever had anybody that butchered their tongue or really stuck their tongue bad with these. Just the tongue will pick that up real quick, and it'd go up about once or twice and hit it, but that's about it. And then it learns not to go there. But you have to leave them on. I'll leave them on maybe 8 or 10 months, and just the tongue gets so used to them it doesn't pay any attention to them, and then you can take them off, and they stay. Now you need to get a person breathing through their nose if you possibly can, so that they can keep their mouth shut and not stick their tongue up there. If they're still breathing through their mouth, it's hard because you got your tongue already there, and you tend to kind of swallow that way. So try to get the person functioning correctly, and especially get them breathing through their nose, and then you're able to stop the tongue thrust. And I'll show you this lady about 16 years after we finished came in and still had the same retainer. And that's, these little points are going back like that. Now here we've got somebody that's closed down. This is just a typodont, of course, and I'm showing this in here, and these don't reach up and touch the tissue. If you get one hitting the tissue, you can grip it real hard here and then bend this wire back down a little more. The wire gets annealed somewhat when you're soldering this in here, and you have it's not quite as stiff as it would be if it had not been heated up like that. So anyway, here's the lady. She's a school teacher, very stern, and I tell you, I bet you didn't talk back to her. Now this is after we've pulled those together. Now we started in 6 of 82, and those pictures you saw back there were in 84. So we spent a couple of years, or not, maybe not 2 years. Now you see she's in a crossbite. In other words, she's breathing through the mouth, and the tongue is in the bottom arch here. And so when the tongue's down there, it'll put pressure on this, and you'll tend to have cross bites. She must not have been a real terrible tongue thruster, but she's got a open bite and everything, and this is, we see that on adults. Your tongue can just move your teeth all over the place, and if it's not there to go in, when you swallow correctly, your tongue wads up in the top of the mouth and presses on it, and that's what puts the torque in these teeth. It develops the whole maxilla up here, and that is where the airway is, and so you need to get this thing breathing correctly, and it's much easier to stop the tongue thrust if you do, and then it stays stopped. So I'm going to show you this. Alright, here it is in 3 of 84, and we have gone in and stopped that. That showed the same. That's the side of the model, and there's the side in the mouth in 3 of 84, and we started something about 5 of 82 or something like that. Alright, so we've got the appliance off and everything here at this point. Now, here is looking at it from the front of the mouth, and we figured that when I measured out everything in here, I needed to get rid of this tooth. It would be a kind of a major problem here if we didn't do that. Now this case is also class 1 on one side, and it's class 2 on the other side. Let me go back and see. This side is the right side, and it looks like it's good. Well, that's on the, after we finished it. And it was class 1 to start with. Now, and it's still class 1 here. Now, at this point, we decided to take out that lower central. That's the lower right central. And we left the other, and they filled the gap. I'll show you that. Now, here is after we close to this midline's not exactly over there, but not bad. And the overbite and overjet is real good. And this is where, and I'm going to show it to you 16 years later, she came in. Now this is setting in there good, and we expanded the arch, and these upper teeth are over on the other side where she had a crossbite in there. Now, if I look at the models here, well, this one's class 1 also. Here, so I was wrong. It's just class 1 on both sides. But we've got a kind of a class 2 problem here. So we spread the upper out more and pull this in and line it up to finish that up. Now here it is after we have finished it, and it's in a good class 1, and this stayed that way over the years. Now you can tell we widened this arch out, something like that, and made it work a lot better. And that corrected that. So we did that with arch wires. Maybe I stuck one of those large arch wires on there to expand it. I'm not certain about that, but anyway, it's expanded. And here it is in 1982, 6 of 82. We took this out. We pulled this tooth up, and it took up about that much room. Then this room will come right in here and here. So in doing this, we brought this back some, and then as we straightened the upper out, it worked quite good. So I measured that out and worked that out prior to starting the case. And that's something you can do. Now we put those together, and the incisal edges are lined up in its back, and that's the way it looked like in that was 84. And here's the facial structure. Alright, here she is in I think this is, boy, she's stern looking. Now she smiled. Now this is 2000. Now wait, this is 2000. And this was 84. So this is 16 years after we finished it. Here's the lady came in and she was wearing this retainer. And this is in 2000. And we were showing this other in 1984, and this is 2000. So it's 16 years after we finished it. And here it is. It's centered out a little better than it was, and it's still lined up, still class 1. She's had a lot of crowns done on some of her teeth and other things, but this is, from the time we started, it is 18 years after we started this, and this is holding good. I'm sure if it wasn't, she would have been in there and get me to get that thing fixed right. So it's still class 1 all the way around, and this is in 2000. Now there's some gold crowns, and she still had the same retainer in, and after all this time, and she's had crowns and a lot of dental work done on it, but it stayed. And these teeth are lined up a little bit problem right there, but not much. And we didn't even have a bonded 3-to-3 or anything in there holding it. But we wore an upper retainer, and she was quite good at wearing it. And here it is, and it has a little ramp here where the lower teeth fit right in this place, and that kind of held them in position. Now these teeth didn't fit much anymore. This was after they put crowns in here, and they may have moved them out a little bit in doing that. So anyway, here is this retainer that we made in 1984, and here it is 16 years later. She's still wearing that retainer. So this was made in 3 of 1984, and it's 2000 here. So that's how long that retainer has been. She's been wearing that retainer. And I'm going to go back and there it is. After, that's 16 years after we finished the case, and it is still good. So apparently we got her breathing right and functioning right, and she still wore these things. And so I hope you picked up something from this, and I'm going to close out now and say goodbye, and I'm going to go back to bed. But anyway, I'm with the American Orthodontic Society, and I'll pull over here and stop this thing now. So goodbye.